Congestive heart failure, CHF, and respiratory failure are two distinct but serious conditions that affect the heart and lungs, respectively. In CHF, the heart becomes unable to pump blood effectively, leading to symptoms such as shortness of breath, fatigue, and swelling of the legs due to fluid accumulation. Respiratory failure occurs when the lungs can't exchange oxygen and carbon dioxide properly, causing symptoms like severe shortness of breath, rapid breathing, and a bluish tint to the skin from lack of oxygen. Treatment for CHF often includes medications, lifestyle changes, and in severe cases, surgery, while respiratory failure may require supplemental oxygen, mechanical ventilation, and addressing the underlying cause. Risk factors for CHF include hypertension, coronary artery disease, and diabetes, whereas smoking, chronic lung conditions, and trauma can increase the risk of respiratory failure. Here's detailed aspects of each disease, offering deeper insight into their distinct causes, progressions, and interventions. Onset speed, acute versus chronic. Congestive heart failure and respiratory failure can present with overlapping symptoms such as shortness of breath and fatigue. However, their onset speeds are a critical differentiator in diagnosis. Congestive heart failure often develops chronically, with the heart slowly losing its ability to pump efficiently. Patients may experience gradually worsening exercise intolerance and fluid buildup over time. In contrast, acute respiratory failure can occur suddenly as the lungs fail to maintain adequate gas exchange, leading to rapid onset hypoxemia or hypercapnia. Prompt recognition of the onset speed helps clinicians distinguish between these conditions, guiding appropriate interventions, whether it's diuretics and lifestyle changes for heart failure or ventilation support for respiratory failure. Primary system affected, cardiovascular respiratory. Congestive heart failure, CHF, primarily affects the cardiovascular system, leading to insufficient blood pump function by the heart, which causes fluid buildup, particularly in the lungs, legs, and abdomen. This can result in fatigue, shortness of breath, and edema. Contrastingly, respiratory failure is a consequence of inadequate gas exchange by the respiratory system, resulting in either low oxygen levels or high carbon dioxide levels in the blood. It manifests as breathlessness, rapid breathing, and potentially cyanosis, a bluish color to the skin. While both conditions share symptoms like breathing difficulty, their treatment and management strategies differ, with CHF often requiring diuretics and heart support medications, whereas respiratory failure might necessitate supplemental oxygen or mechanical ventilation, addressing the underlying lung pathology. Distinguishing between these two conditions is crucial as it significantly influences the therapeutic approach and patient prognosis. Primary symptom location, systemic circulation versus lungs. In distinguishing between congestive heart failure, CHF, and respiratory failure, the primary symptom location provides a vital clue. CHF, often a systemic circulation issue, typically presents with symptoms such as peripheral edema, fatigue, and dyspnea due to fluid overload and the heart's inability to pump effectively. This leads to a backup of fluid in the lungs and other tissues. Conversely, respiratory failure, centering on the lungs, is characterized by the inability to exchange gas efficiently, leading to inadequate oxygen levels or excessive carbon dioxide in the blood. Patients might exhibit rapid breathing, cyanosis, and altered mental status, pinpointing the primary dysfunction within the respiratory system itself. Understanding these distinct presentations can guide healthcare professionals towards appropriate diagnostics and management. Usual cause, cardiac dysfunction versus pulmonary dysfunction. Congestive heart failure, CHF, and respiratory failure present a diagnostic challenge due to overlapping symptoms such as shortness of breath and fatigue. CHF stems primarily from cardiac dysfunction, where the heart's weakened state leads to inadequate circulation, causing fluid buildup in tissues and organs, notably the lungs. This fluid can mimic respiratory distress but originates from the heart's failure to pump effectively. Conversely, respiratory failure is typically a result of pulmonary dysfunction. In this case, the lungs' ability to exchange gas is compromised, meaning oxygen levels decrease while carbon dioxide levels increase, resulting in hypoxemia and hypercapnia. Accurate diagnosis hinges on recognizing that CHF is characterized by systemic fluid overload and poor perfusion, while respiratory failure features inadequate gas exchange mainly localized to the respiratory system. Breathing characteristics. Effort-related dyspnea versus resting dyspnea. Effort-related dyspnea in congestive heart failure typically manifests due to the heart's reduced ability to pump blood efficiently, leading to fluid buildup in the lungs, especially during physical exertion. The increased workload on the heart during activity exacerbates this condition, causing breathlessness as the lungs struggle to oxygenate the blood. In contrast, respiratory failure, particularly of the chronic variety, can lead to resting dyspnea, where breathing difficulties occur even without the strain of physical activity. This can be a result of impaired lung function or obstructed airways, which hinder oxygen intake and carbon dioxide expulsion, making the simple act of breathing laborious and insufficient at rest. Recognizing the context in which dyspnea arises is critical in distinguishing between these two conditions and can guide appropriate diagnostic and therapeutic strategies.